Some people may see it as complacent that you see nothing in the data at the moment to give you any cause for concern, particularly when you've got people like the NHS Confederation and many senior scientists arguing that all the warning signs are there. Give us a number. How bad do hospital admissions need to get per day before you do bring in Plan B? And can I ask you a question also on the antivirals? There will be many people who, with weakened immune systems now, who are very concerned about the surge, hopeful that these drugs might be there for them. Will they be?
The first part of your question, that we are concerned. I think everyone is right to be concerned, and I hope that I've managed to, just in the last sort of 10 minutes, express that concern that we have and the reasons why we do, with the cases rising, as Jenny has just shown in some of the latest data as well. Deaths, as I said, are still mostly low, but they're still more than 100. And the focus, though, very much remains on what we set out in Plan A. Those vaccines that they are working. They are, as Steve has just alluded to, we've seen from the data, if you look at the hospital admissions as well, the vaccines are clearly working. We estimate, the ONS estimates that they've saved some 130,000 lives. They've prevented some 240,000 people from being hospitalized. They've prevented some 24 million infections. That's what the vaccines are doing. So if more people get vaccinated, including, by the way, just to emphasize again, the 5 million or so across the UK that haven't even had their first jab. And that's why I said, if you know someone, please appeal to them, speak to your friends, your relatives, and just really sort of nudge them and say, please, do your bit to help yourself and help others. And if they've got some weird ideas about vaccines because they've been reading misinformation on the internet or elsewhere, then point them in the right direction. But the vaccines are absolutely key. And as Steve has also said, the flu vaccine this year is more important than ever. It's our biggest flu vaccination program in history. I think some 35 million doses that we've got, and the people together that we're targeting with that to really help combat both those viruses. So that's our plan. We remain cautious, and and you asked me what's the number of hospitalizations that we monitor this daily. We work very carefully, obviously, the department with the NHS on a daily basis, and it's not just one particular number that we're looking at. And I'm very conscious that behind these numbers, you often talk about numbers easily, but there's a person, there's an individual, there's a family that's being affected. We're very conscious of that. But as well as hospitalizations, we're looking at the pressure on the NHS across the board, on A&E, on primary care, on emergency services such as others, like 999, the ambulance services. So we're looking at a number of factors and taking them all into account. On the drugs, the new antivirals, I can tell you a bit more about them, but in terms of the total that we've put, is 730,000 courses, patient courses we've purchased. That's 480,000 courses of the Merck that I referred to, and then 250,000 from Pfizer. It's important also, I think, to state they work differently. They have different mechanisms. So it could be one or the other that might be deployed. In some cases, it might be both. They're both oral, and they can be deployed either if someone has fallen ill, or if from COVID, or if you expect that they might do because there's an outbreak, let's say in a care home, where you would naturally have vulnerable people. It's a really new sort of fresh tool in our armour. These are the first antivirals ever that are designed specifically for COVID. They still need to get approval from the MHRA. The tests that are publicly available at the moment have been very encouraging, but we wanted to get there in early and sign a deal so that we can be one of the first countries in the world to receive them should they be approved by our regulator as safe and effective. Steve, did you want to add to that?
Yes, well, I think as the Secretary of State has said, there is no one number that we would use to think about triggering further interventions, because it is more complex than that. There is a variety of things that we look at. So we talked about infection rates, because they tell us what's likely to happen in the NHS in the next few weeks. We've talked about vaccine effectiveness, because that tells us how many people are likely to require hospitalisation. We look at, obviously, the number of admissions, but we also look at what's happening with flu and other viruses and what's happening with other emergency admissions. So there's a variety of things that we will be looking at and continue to look at. And, of course, the final thing to say is that we do see geographical variation. So what's happening in one part of the country might not be happening in another part of the country. That's been typical of the pandemic over the last 18 months. And it's possible that we will see that variation again. So there is no one number to look at. We have to look at things in the round, look at all these numbers, use judgment, and, of course, work closely with colleagues in UKHSA on the public health side, Department of Health and Social Care, to take a collective judgment. And on the antivirals, it is indeed great news. I mean, as the Secretary of State has said, we, over the last 18 months, I think one of the things that has been most impressive about the response of the NHS, its ability to stand up drugs rapidly, to investigate drugs, and to work out which drugs are truly effective at managing this pandemic. And that has undoubtedly saved many lives in the UK, but actually throughout the world. And I think we should be really proud that a public health system, healthcare system such as ours is very well placed to do that sort of study, and we've shown that we can do it. So we have these new antivirals coming on stream. Molnupiravir is likely to be the first one. In terms of who should get it, clearly that is a little bit dependent on the MHRA, who need to license it, and they will license it with their particular licensing conditions. We will, of course, be taking advice from clinical experts as to who it is most appropriate. But in general, we would want to target these drugs, as we have done in the past, at those at the highest risk of infection and the highest risk of hospitalisation, because that is what we are most trying to avoid, and of course death. And so yes, I think it is likely that individuals with weakened immune systems are likely to be on that list that our clinical experts would recommend. But let's wait until we get the MHRA licensing, and let's wait until we get the advice of our clinical experts.